Trojana Conference over to Elisa Erzbach-Achaga. Please go ahead.
Thanks so much, Stephanie, and good afternoon and welcome, folks. I'm really excited for today's webinar, which we've titled Earn While You Learn. You'll see on the screen, Innovation During a Pandemic, because there aren't better ways to describe this. As Stephanie mentioned, I'm Elisa Erzbach-Achaga, Vice President of Clinical Affairs and Workforce at the AHA, and I'm really pleased to have this team with us today to share the work that they've been doing to really create ways to innovate in the middle of a pandemic and really provide the best care possible and the best training possible to their teams. So I'm going to start by turning this over to Terry Gaffney, Assistant Professor at the Melick School of Nursing at Marymount University, who will introduce our speakers along the way. But I'm just really thrilled with the work that they've been able to do, and I hope you enjoy the discussion as well. And as mentioned, don't forget to type your questions into the chat box. With that, Terry, I'll turn it over to you.
Well, thank you. And we are thrilled to have this opportunity to share this model. So we know that new graduate nurses have difficulty adapting to the realities of healthcare and their responsibilities in their new role. The literature informs us that it takes up to the first year of practice for new graduate nurses to become practice ready. Just imagine if we could accelerate that process. In Virginia, practice, education, and regulation came together to explore innovative models of clinical nursing education. And the Earn While You Learn model that you'll hear about today tests a unique concept that accelerates practice readiness by bridging the gap between education and practice while addressing the critical demand for more nurses. Mary Washington Healthcare and Germanna Community College formed an academic practice partnership, and Eileen Dohmann, the Senior Vice President and Chief Nursing Officer of Mary Washington Healthcare, and Patti, Lisk, Dean of Nursing at Germanna Community College, will share how they tested this model and their results. Following their remarks, Jacqueline Wilmoth with the Virginia Board of Nursing will speak to the regulatory challenges of this model. So Patti, I'm going to hand it off to you.
Thank you, Terry, very much. We are indeed very excited to be here today. My name is Patti Lisk. I am the Dean of Nursing and Health Technologies at Germanna Community College. And joining me is Eileen Dohmann, Senior Vice President and Chief Nursing Officer for Mary Washington Healthcare. We are so excited to talk to you about our innovative model that meets workforce and clinical needs. So Mary Washington and Germanna have had a long history of partnership. In fact, Germanna will graduate its 50th year of nurses this coming spring. So that doesn't mean we just graduated once a year. We graduate twice a year. So we've graduated a lot of nurses. And throughout that time, Mary Washington Healthcare has been our clinical partner, our primary clinical partner. So therefore, as you might guess, Mary Washington Hospital has a long history of hiring our graduates, our registered nurses. We've also partnered together when the Institute of Medicine recommended that nurses have their Bachelor of Science in Nursing. At this point, Mary Washington and Germanna and a local university partnered together to establish an RN to BSN program. And it's very unique in the fact that it's totally seamless for our students, and they complete 30 credits at the university and then have their Bachelor of Science in Nursing. So Germanna, like many other programs in the nation, has been facing many challenges with the pandemic, none the least being clinical placements and faculty shortages. But I must say it has been so helpful to have a partner like Mary Washington to walk through the situation and creatively solve problems with us during this pandemic.
Good afternoon. This is Eileen Dohmann from Mary Washington. What I'd like to do is to sort of set the stage or recast sort of what the definition of the need was. And this really started back in the fall of 2020. So at the moment, at that time, we thought we were in the height of the pandemic, little did we know. But what was really, we were experiencing at Mary Washington Healthcare is that first big increase in the need for CNAs and RNs. We were seeing that turnover start to take off and start to increase in a negative way. And so there was a definite increase in needs for particularly our CNAs, CNA needs and vacancies. And because we were seeing turnover and we were seeing vacancies not able to replace, certainly the morale and the resilience of the nursing team at Mary Washington Healthcare was very challenged. But we weren't the only ones that were challenged. The Germanna nursing students were also experiencing challenges.
Yes, they were. Yes, they were. Our students were challenged from the fact that they needed jobs. During the pandemic, they lost their jobs related to retail and to hospitality, and they needed to feed their families because community college students, unlike other students, I mean, some do have to work, but community college students usually have a job on the side, so it was quite challenging for them. Another thing that happened during the pandemic is whereas the community college students, after one semester of the nursing program, usually sits for their certified nursing exam in the state of Virginia. Well, because of the pandemic, the testing sites were closed, so the students couldn't sit for that testing exam, and therefore they couldn't go to work as certified nursing assistants. So that was a problem for them. In addition, the students had difficulty getting clinical because for a large period of time in the state of Virginia, we were asked not to send our students to the clinical setting. So this model helps to address some of those problems.
So from my perspective as the CNO, really was looking for how can I increase our CNAs at the bedside? Is there at least one part of our workforce that I could augment quickly that I could tap into? So it really came down to who could help us. And when I thought about that, I thought, well, how could we use nursing students? Could they help us? And so I reached out to my partner, Germanna, and to Dr. Lisk, and said, what could we do? We worked through that. Okay, they can't be certified nursing assistants because they can't get test dates, but what could we do? And what we came up with was we created this role of a nursing assistant. And so we started it as a pilot between Germanna and Mary Washington. We started it in a cohort model. So we were going to hire a group of them at one time in a cohort. And so we decided that we would start with the first group. The first pilot would be a group of 30 Germanna students. The requirement would be that they had to have completed at least one clinical semester, so they met the eligibility for sitting for the CNA exam, and they needed to be enrolled in school. So we came up with the job description of what the nursing assistant role would be. We then knew that we would have to tell the students about it, encourage them to apply, interview and competency validate them, because with many of them being first semester students, much of their clinical experience had been in simulation. So we wanted to interview them and do competency validation, but we also knew that this would be unsettling for the students because they hadn't had a lot of clinical exposure. So Germanna was able to allow us to actually do that interview and competency validation on campus in a setting that the students were already comfortable in and in their simulation lab. We also had to consider onboarding and how we would orient this group of 30 who were all being hired at the same time. At that time, I didn't have enough CNA preceptors that could actually have them be precepted by a CNA. And so what we did with the onboarding process is we onboarded them as a cohort, and we used our nurse educators where they took the group of 30, divided them into 3 groups of 10, and actually took them to the clinical units and onboarded them on the unit, much the way that they're used to their traditional clinical rotation model where they go to a unit with a faculty member and the faculty member is with them as they are doing their clinical rotation on the unit. And then we wanted to make sure that once we onboarded them, that we stayed closely connected to them, that it was a good experience for them. And so we established monthly follow-up meetings where the cohort comes together and we meet with them to get their feedback about how things are going. Now, I have to tell you that we were extremely fortunate in this first time because from the moment Patti and I agreed to the role to the first day that this group started working was actually just over 3 weeks, based on great dedication from our teams, our nurse educators at Mary Washington, our HR partners. We literally introduced the idea to the students. They were able to apply right online in the moment. Within a week, we scheduled the interviews, the competency validation, and then within 10 days, they had their start date and they were started as that cohort.
That's true. That was quite an amazing thing, an amazing feat. It was great for our students and I hope great for the hospital. But one of the things that we thought was really, really exciting was the response of the staff nurses and the students. So like Eileen said, we onboarded the first 30 in December of 2020. And the students, their first remarks was, I feel like everything that I have learned in school is making sense. I'm like, yay, all right. And then to Eileen, one of the staff nurses emailed and said, you promised us help. Help arrived today, and it's called a nursing assistant. So it shows that, in fact, these students were well received on the floor. They have been positive their whole time. Eileen and I refer to them as the pioneers because they did go where others haven't gone before. The RNs and the CNAs have accepted them in that role. We talked, Eileen and I, a little bit about how CNAs might feel about having nurse assistants on the floor, but truthfully that has not panned out to be a problem at all. We have allowed the students to take the Cassie Vink transition to practice survey, and we're using that for ongoing outcome evaluation. The second cohort of students applied in March during their spring break, and 15 additional students were onboarded at that time. A third cohort came on in June with 16 more additional students, and we anticipate onboarding our next cohort in December 2021, and they'll have their introductory meeting this week. So yeah, it continues. The other exciting thing about what's going to happen this week is we've invited another school of nursing to participate with us.
And I think it's important also for us to note the limitations we put on the role. They're hired into the hospital, the health system staffing office, but they have to work a minimum of 12 hours a week, but a maximum of 20 hours a week while school is in session. When school's not in session, they can work up to full-time if they're indeed needed. But we've also really conveyed very strongly to the nursing assistants that school comes first. So if there is a circumstance where a student needs to work less than their 12 hours, we certainly have accommodated that. And if we have someone that says they really want to work more than 20, we don't allow that because we want to make sure that they don't shortchange school. So our lessons learned, as Patti mentioned, great RN and CNA acceptance. In fact, with the second cohort, there was a group of our CNAs that actually stepped up and asked if they could precept and get involved with the precepting process. And it was interesting, the way they asked that was, we want to make sure that we can teach them what the CNA role is so that they know that really well when they're an RN, that they really understand what the CNA role is. So we haven't run into any issue with the CNAs feeling in any way devalued. In fact, we have used them as preceptors quite successfully. When we initially had the success of the first group, our intention was to keep the onboarding very intense, do it in a week's period of time. And so we thought that we would bring on 3 cohorts a year around the winter holidays, so in that December time frame. We thought we would do another cohort in March during spring break, and then the third cohort in late May or June when school ended. When we did our March cohort in 2021, what we found is that it was really too much for the students. They're really on a week's break in the middle of a semester, and they're coming back to what actually is the heaviest load of their semester when they come back. So really trying to cram all of that into that 1 week, it was too hard, and they didn't get a break from school. So we've now since decided that on an ongoing basis, we will bring on cohorts twice a year. That will be in May, June, and then in December. Thus, why we are bringing on a much larger group in this December, a group up to 60. And then the other was if we could show success in what we saw in our first 3 cohorts, then why not expand this to other nursing programs? And as Patti mentioned, that is what we're doing with the December cohort. As we saw success with the nursing assistant model, what it really sort of triggered for me was watching them on the units and seeing these are nursing assistants. They go to every unit in the hospital because they're part of the staffing office. They're part of the float pool. So, my one real intent was getting them more comfortable in the clinical setting. And that absolutely has been proven. They are very comfortable going to whatever unit they're being asked to go to. They're welcomed when they get there. But then watching what they were doing is there some way that they can earn academic credit for the work that they're doing as a nursing assistant? Do we have some way that we can meld the role of the nursing assistant and the traditional clinical rotation model? And so what we started in September of 2021 is we actually changed the clinical rotation model through a pilot. And we also wanted to talk about our next steps of piloting joint appointment of faculty. So let me tell you a little bit about what we've seen in the nursing assistant student experience pilot. So we started it in the fall of this year. We focused on 3rd semester nursing assistants. So they are in their 3rd semester at Germanna. For 3rd semester students, they have a requirement to do 64 hours of a med-surg rotation. So we just took 36 of those hours. So the remaining 28, they remain in their traditional clinical rotation model. Now, this time is true nursing student time. So they are not working as a nursing assistant. They are a student. And we were very purposeful, and they come in their student nurse uniform. We reinforce that they are a student when they are doing these clinical rotations so that they're following the rules and the roles that are outlined within their student capacity. And we took the 16 of these 3rd semester nursing assistants with 1 faculty from Germanna. And what we did is we had them work 3 12-hour shifts. Each 12-hour shift, they would be with an RN mentor. That RN mentor is one of our hospital staff nurses. And what we did differently, and again, trying to look at the traditional clinical rotation model, is I sort of observed it as a little bit of parallel play, the traditional clinical rotation model. If you think about it, our nurses work 12-hour shifts. So 7A or 7P, nurses come on to work their shift, they get their assignment, they do their bedside shift report rounding, they set up their day, they're rolling through their day, and a couple of hours later, a faculty member arrives on the floor with a group of students. The nurses may know that the students are arriving, and they may even know which patients they're going to take, but it does disrupt the nurse's workflow because the nurse now has to think, okay, now there's a student involved in my patient's care, so how does that change what I was thinking that I needed to do in my shift? It also occurred to us that when that nurse may have a student with them in that traditional clinical rotation model, how do they know what the students are needing to learn? While we've always emphasized that we ask faculty to share their students' learning objectives and clinical competency objectives with the nurse manager, we've never spent a lot of time explaining to the staff nurse what these students, what their clinical objectives are for the semester, what their clinical competencies are. So we really took the time with these RN mentors and we trained them in what the students' learning objectives and clinical competency goals are for the semester. So it really does cast it as a different role than what they were used to before, as we really charge them with your job for these 12 hours is to teach this student how to be able to be a nurse and to help them to achieve their learning objectives and clinical competency goals. We assigned the students in groups of 5. They were scheduled for their 12-hour shift on either a Monday or a Tuesday. They tend to be the busiest days of the week on a med-surg unit. Their faculty member was continuously rounding throughout the building, checking on them because they were on a variety of 6 different units. And so each of them are doing that for 3 12-hour shifts. The remaining 28 hours of their their required med-surg clinicals are being done in a traditional clinical rotation model with that same faculty. They're actually doing that on some weekend shifts. During this nursing assistant student pilot, we also make sure that that once-a-month meeting that I mentioned that we have with all of the nursing assistants once a month, we now take part of that time specifically for the 15 that are in this student experience pilot to really talk to them and use their QSIN learning structure to actually talk to them about what their learning has been through these 3 12-hour shifts. And as Patti mentioned, we continue with the Casey Fink Transition to Practice survey before they started this 36-hour rotation and then at the completion of the 36-hour rotation.
So we've learned a lot of important things throughout this process, most of them very good, I must say. And some of them were huge ahas for me, like, really, why wasn't I doing that before? So one of the first things that we learned was that the RN mentors really appreciate knowing the students' schedules and their learning objectives and their clinical competencies. I think the extra time spent investing in those RNs and telling them about what the students was learning was payback yards. They commented that it was helpful to the students, and the students commented how helpful it was. So whereas we thought we were doing a good job of that before, it turns out perhaps we were not. So that's one lesson learned. Student feedback, again, it made me pause and go, well, what am I doing in clinical? One student said, I did more clinical skills today than I've done in all my previous clinicals combined. Now remember, they're in the 3rd semester of a 4-semester program. That made me pause and think, what are we doing? And then, P.S., why can't the rest of the students have this wonderful experience? Why are these 16 the ones that get this experience? So that gives me pause to think as well. One student said, I gave so many medications. Well, of course they did. They're on that 12-hour shift with their nurse. Another one said, I inserted a Foley, and it wasn't even in the sim lab. And the one that touched me the most, I think, was, I felt like an RN today. So another way that we've collected data on these students is they've completed journals. And so in reviewing that qualitative information, Eileen and I looked at it, and you could see the students and their language in the journals changed as they adapted more and more to the RN role. They moved from I'm helping the nurse to almost like I was the nurse. So that was very encouraging as well in the transition to practice. Now, on the other hand, with the RNs say that the students are more comfortable on the unit. Yes, they are. They don't have to go through a lot of hurdles because they're familiar with the hospital when they first arrive on the unit, like some students do. They also said these students are different. They're more confident. Now, when our, like Eileen mentioned earlier, this was just 36 hours of their clinical, required med-surg clinical. The remainder of the clinical they spent with their nursing faculty in a traditional clinical model. Now, when that faculty took the students onto a different floor, the nurses on the floor were like, well, what's with these students? These are the best nursing students I've ever seen. So what a huge compliment to the process and to those students. As Eileen says, we're looking towards doing some joint appointments of faculty with the hospital and the college in the spring. We're planning in the spring to continue with the model that we're using in the 3rd semester that involves the nurse mentors and the Germanna faculty who oversees those mentors and students. But we're going to expand the model for our pioneers, and those were the ones who've already done it this 3rd semester. We thought, how can we put them back into just their traditional clinical after they've had such a wonderful experience? So what we're planning to do with these 4th semester students is we're planning to put them into a similar mentor model, but we're going to put them on the night shift. Because so often many of the students or the graduates, they begin on the night shift, and some of them have never even experienced that environment or that shift. And those of us who are nurses know that that shift is very different than the day shift. So we're looking forward to that opportunity in the spring. At this point, I'd like to hand the presentation over to Jacqueline Wilmot, who will speak to some of the regulatory situations involved in this model.
Good afternoon, everyone. Thank you, Patti. This is Jacqueline with the Virginia Board of Nursing. When Patti and Eileen first got together and these ideas started brewing, she reached out to me to get some input from the board and to just verify that everything would be okay in regards to regulation. Based on her plan and the regulations that are currently in effect, there are no regulatory barriers with this pilot. The pilot follows our preceptor regulations as well as the clinical regulations when students are in the traditional clinical. The board has been very supportive and will continue to be supportive of pilots in this area. We are thankful for the innovation that Patti and Eileen are utilizing with this pilot, especially in the times of COVID. And we are also very thankful for the collaborative approach that has been taken to really have that academic practice and regulatory collaborative efforts. So at this time, if there are any questions, we are all available to answer them.
Thank you so much to all of you for sharing the work that you've done. Again, if you have a question to ask, please feel free to type it in the chat box. I will start off. I'm curious how, Eileen, especially for you, did you prepare sort of the rest of the team beyond nursing for this change, and how impactful was it to the rest of your team as you were trying to get through, get additional help in the middle of the pandemic?
The team, we did a lot of communicating, and as you can imagine, because of where we were with the pandemic, I was very concerned, as was Patti, that this be a good experience for the students, because certainly the goal of doing the nursing assistant role, while it meets an immediate workforce need for the hospital, I didn't want that to do anything that would sidetrack them from their role as a student nurse, because I ultimately want them as an RN too. And so we did a lot of internal communicating about the role. I will say that to this day, and I know it's something Patti's very, very proud of, we call them pioneers, that first group, because you can pick them out. They came to this so positive, so excited, so energetic, that it's been very easy for the rest of the care team to be accepting of them. They know that it's okay to ask questions, so it's been relatively easy. The care team saw them as help, and it's actually also something I'll mention in the clinical rotation pilot. When we were reaching out to the RN mentors, we spent a lot of time talking about, making sure that you're teaching the nursing student that these are the objectives they have to meet. Make sure you keep that in mind. And it was interesting. I didn't emphasize at first that, and oh, by the way, they're a nursing assistant. So for your 12-hour shift, you have your own nursing assistant working side by side with you. And it wasn't until after each of them had their first shift where I asked the RN mentor, was it a help to have a nursing student with you that could work, that was familiar with working in that nursing assistant role? And 100% of them said absolutely yes. They made my day easier so I could focus on teaching them. And to the nursing assistants, as they moved through their second and third shift, they each said, my RN made me think like a nurse. The RN that my RN mentor asked me questions about, well, what would you do in this situation? So that they really grasped the idea that while it's great to have the nursing assistant help, this is a different way for us to educate nurses in the future, and they really, embraced that part of the role as well.
That's wonderful. And then, Patti, a question for you maybe. Are you thinking about expanding this to other roles, again, beyond nursing? I mean, I see this as such a great opportunity to continue to prepare and encourage our teams to really know what their what profession they're getting into and to really be better prepared. So I'd be curious from the community college perspective if you're thinking about expanding this work even into other roles.
It's funny that you would ask that. Eileen and I have actually had that conversation about our surgical technologist. This makes a great pathway for students to work in the hospital environment, to become comfortable in it, and then to go on and work as a full-time employee. So yes, we are looking at other internship opportunities for our students.
It really is a take on an apprenticeship model, right? Mm-hmm. So getting them to work in the environment, get more comfortable in the environment, because that's what we see so often with new graduate RNs is they become very task-focused because they're uncomfortable in the environment. They think of all the things they have to do, and we always say, oh, where's the critical thinking? You know, why are they so task-oriented? I believe part of their focus on task is because they're not comfortable in the setting. But if we could increase their comfort, I think we would see, and we are seeing, more of their critical thinking, better time management, better communication, things that we've given, you know, we've had that feedback that those are areas of challenge for our new graduate RNs.
Absolutely. Absolutely. So is there something you would do differently, having gone through this process? You mentioned some of the lessons learned.
Wish we did it sooner.
Maybe wish we could do it for more.
Yeah. I think we've been pretty nimble, and I think Patti and I have been, we've been very, very on top of this because we don't want it to falter. So that I think staying closely connected to the students, to the RN mentors, to our educators, to the faculty, and really looking for that any challenges, how we could address those right away. So we stayed closely connected to that.
Right.
And I would say having a partner like Eileen, who is so focused on the success of the students, just as I am, has made it very easy. As she said from the very beginning when I said, oh, please, they can't work more than 20 hours, she didn't even blink at that. She's like, okay, I get it, I get it. So at every turn, she's been there to support the students with me. So that has made this a very easy endeavor.
I do see a question in the chat about will we be able to plan to follow these students after they graduate to see if they continue in the RN role and seeing what happens over their first 1 to 2 years. I hope that we get to hire more of them. So absolutely, for those that we're able to hire and to track, we've got lots of things that we want to track about this group. And the really neat thing is at Mary Washington Healthcare, we have a research practice council, and that council has now stepped up and said, hey, there's some studies, there's some questions that we'd like to answer, there's some research we'd like to do with this group. So it's really great that they've stepped up and said, let's look at what we want to track and what we want to monitor with this group as they go forward.
Great. So you'll really be able to see if this is one of those solutions that can help support. Looks like we've got a couple other questions, including Marcia asking, what are some of the differences between the nursing assistant and the CNA roles?
From a clinical perspective, they're pretty much the same. Our CNA role also includes some clerical and some medical record functions, and we did not include those in the nursing assistant role. So from a clinical perspective, they're very similar.
The other interesting thing that we have talked to Jacqueline about, Eileen and I, is how would that nursing assistant role advance as the student advances in school? So that's something we haven't noodled out yet. I guess that's our next project, but we certainly see that as something that would help the student also. I think one of our greatest concerns was that the students would go into this mentorship model and be used as CNAs, and therefore their thinking would not advance. So Eileen and I are both on the same page. We want them to be thinking like a nurse when they're in clinical. That did not come to fruition that they were in the CNA role. In fact, they were encouraged to think like a nurse, so that was excellent. So we're thinking about how can we move them up in that role as they continue in school. So if anybody has great ideas about that, I'm open for them.
Great. There's also a question about how much the role was paid. So for the nursing assistants, they're paid $15 an hour, and they're in the staffing office. So if there's differentials, working evenings, nights, weekends, they're certainly eligible for that as well.
Great, thank you. Don't see any other questions in the chat. I'll pause a second to see if there are any others. But thank you again so much for sharing the great work that you're doing. If anyone else has any other questions to ask, please feel free to just chime in. But otherwise, I just want to thank our presenters for sharing your great program and for continuing to spread it. I'm looking forward to hearing what your next cohorts already look like.
Thank you. It's been a pleasure.
Great. Doesn't look like we have any other questions. So with that, I will close this out. But thank you again to all our presenters, and thank you to our participants. And I look forward to hearing more about this program in the future.
Thank you, ladies and gentlemen. This concludes today's presentation. You may now disconnect.